Hey mental workers, you're listening to the Mental Work Podcast, the podcast about working in mental health for early career mental health workers. As always, I'm your host, Bronwyn Milkins, and today we're talking about something many early career mental health workers experience, which is the emotional toll of starting out in therapy. Our guest today is also located in Switzerland, so I also thought we'd take the opportunity to discuss what it's like delivering therapy in Switzerland and differences and similarities in approaches compared to Australia. If you've ever wondered what therapy looks like on the other side of the world or want some reassurance that you're not alone in feeling overwhelmed by starting to deliver therapy, then this episode is for you. Our guest today is Tiffany. Hi, Tiffany.
Hi, or as we usually say in our language, hoi.
Hoi.
Yeah, hi. As you heard, I'm from Switzerland and I'm a licensed psychotherapist currently working in an outpatient clinic. But I'm also undertaking a further study now in emergency psychology, but that's going to take a while. But I'm really excited to go that further path.
That's awesome. And I'm already immediately interested in emergency training. So I guess the first thing I want to ask you is, what does training look like in Switzerland? Like, how do you become a licensed psychotherapist?
hmm So the regular thing is that you kind of study psychology. It can be 5 to 6 years, depending on if you have to take an exam again, because sometimes you fail and then you just take it again the next year. So it just like kind of pushes out. And after that, you can actually decide if you want to be a licensed psychotherapist or if you just want to stay like a psychologist after your master's degree. So if you would just stay after the master's degree as a psychologist, you can work everywhere, but you always have to be dependent on a working environment, like a clinic or a outpatient clinic. So, but if you want to go the psychotherapist way, um, it's up to 6 years again. So in total, you will be studying around 12 years.
Wow.
Yeah. It's a long journey. Yeah, but you can also just do it for 4 years, depending on how quick you are. So the
I
usual
see.
is between 4 and 6 years.
Okay. So
Yeah.
can psychologists do therapy? It sounds like there's psychologists and then there's psychotherapists, but psychologists can do therapy too. They just have to be in like a business or organization.
Exactly,
Okay.
exactly. And if you're a licensed psychotherapist, you could also open up your own outpatient clinic, kind of. So that's
Wow.
pretty cool.
Yeah,
Yeah.
that's really interesting. We don't have that here in Australia. We have like psychologist is the regulated term. So that means that our
Yeah.
profession, you have to abide by quite a strict set of ethics. But psychotherapist, anybody can call themselves a psychotherapist here. It's not a regulated term. So yeah, you
Okay.
don't have to do any training to be called a psychotherapist here.
Oh, wow. Not here in Switzerland. It's so structured and
Yeah,
regulated. And also like during your postgraduate training, you have to it is like it includes theoretical coursework, clinical hours, supervision, and also personal therapy for up to 100 hours that you actually have to go to therapy by yourself. Um, so it's a big one. It's a lot.
that's
Yeah.
so interesting. And that's one thing I wanted to ask you about because it's come up on the podcast before when we've been
Yeah.
talking about international qualifications. But it sounds like it's a requirement to have your own personal therapy in your course. Is that right?
Exactly. It's mandatory and it's part of the psychotherapist training here in Switzerland to just kind of develop self-awareness and building emotional resilience because I I really think our job is emotionally draining at some point and I think it's very important that you kind of know your own history and how you react on certain topics to just be kind of a therapist who listens and not the one who wants to be wants to get therapy kind of.
Totally. And what's the general view of having to get your own therapy amongst like you and your peers? Are people like, "Oh my God, I can't believe I have to do this," or are people like excited for it and grateful for it?
That's a very good question. I think sometimes it can be a bit mixed because so the thing is, like, in Switzerland, that has changed a bit how you get to a psychologist and to get therapy. And so the axis of therapy in Switzerland is like through your GP, who kind of refers the patients to us, or you can privately pay the sessions. That's something we also have. Maybe that's because it's in Switzerland and a lot of people they really want to like sometimes spend their money on therapy. But also like since 2022, Switzerland has actually included a system where psychological services are paid by the health insurance if
Okay.
prescribed by a doctor. And then you just, yeah, go from there. And so we have a lot of people that just come sometimes to just see what therapy is, which is like a really great thing because then you can really open up what is psychology, what is therapy. And some people, they really, really need it. So it's a bit of
Mm.
a mix, I'd say.
Yeah, no, that makes sense.
Yeah.
So in Australia, I would say our dominant therapy that we use is mostly cognitive behavioral therapy. Like that's the main one we get taught at university. And I think after we graduate, we branch out. So like there's EMDR therapy and schema therapy. I guess there are other dominant approaches. What do people gravitate towards in Switzerland?
I also did CBD.
Mm,
It's so that's a prominent one, but we
okay.
also do like psychodynamic and psychoanalytic approaches or even systemic therapy. There's a lot of that,
Yeah.
but also like humanistic and gestalt therapy. So those are like just the four main ones, and a lot of my colleagues, they studied in one of those branches. And but yeah, it's very different actually if you talk to them.
Okay, that's interesting. And what are you, do you have one that you specialize in?
Yes, in the cognitive behavioral therapy.
Oh,
Yeah,
awesome.
yeah.
Fantastic.
So
Yeah,
very similar.
yeah, no, but that's interesting for us if we want to do like psychodynamic or psychoanalytic therapy. It's a pretty specialized path and there's not many
Hmm.
training providers in Australia, so it's a pretty niche
Okay.
one. Yeah, it's pretty niche
Oh
here.
wow. Okay. Okay.
Yeah.
That's so different. Not here is. I mean, the cognitive behavioral therapy is it's the one that most of the institutions they kind of offer to study.
Yeah.
But also the other ones, I do have actually a lot of people that it's like pretty mixed at my workplace. So yeah, yeah, so pretty
Mm.
cool.
Yeah. I was just interested, like, did you find it useful to get your own personal therapy? Like, do you think, because it's not a requirement here in Australia, we don't have to have our own personal therapy as part of training. So I'm just
Oh,
really interested in, like, do you think that's an important part of your course?
I would say 100%. Just because, you're starting off as this newbie in, as a psychologist, and it can be pretty overwhelming. And let's be honest, everyone has their rucksack, and everyone has things that they might react towards more than other people. And I personally think it's actually a great thing that to just, recognize your own patterns, knowing when do you flip, when do things just come a bit too close. And it's a great way to kind of get to know yourself a bit better. So yeah, I'm actually a bit I think it's really sad to hear that you don't have to do that because I think it's such a big part.
Yeah, no, me too. I think we've had a few conversations on this podcast about it
Mhm.
with a few other people. And the psychologists who I speak to, we all talk about how it's really valuable to get your own therapy. And I think it
Mhm.
would be good if it was included in our courses because, like you say, it really does help you identify how you react to things and your own
Mhm.
patterns.
Mhm.
And you get to know what it's like to be
Mhm.
like receiving therapy. There's so many benefits.
100%, yeah. And like it also helps you to experience being the patient as well.
Yeah.
sitting on the other side, because that is a different feeling. And you know every time when you I remember when I went to my own therapy, like personal therapy, it was like sometimes I actually didn't know what topic I want to discuss. And then you just kind of go there and you feel like really bad because you don't have a topic, because you kind of know like it would be great if you would have something to discuss or to talk about. So that really helped me to kind of be more chill with my own patients, to just be like, hey, that's okay, like we'll figure it out, kind of. And
Yeah.
yeah.
That's really interesting. I guess I want to understand a bit more about where you work. So you work in an outpatient program. What does that look like exactly? Because I guess I have an idea of what it looks like here, but I'm wondering if it might be different for you.
Yeah, so I was actually Googling this word, because in Switzerland, we call it praxis, or I work in an ambulatorium, which is very close to a praxis. Um, and I Googled it and it said it's an outpatient clinic. So I think I will just explain. So it's actually just people come for an hour or 75 minutes for their therapy, and then they kind of leave again. So it's like in and out.
Yeah.
And so where I work, I usually see a lot of people a day. That's kind of also the regulation at our office. But it's kind of like 7 to 8 people sometimes. It can be really tough. Yeah, but I really sometimes enjoy it. It depends on my mood and if I was able to kind of shut down after work. But yeah, does that
Is
kind of
seven? Yeah, it does. It's so we usually see like I'd say the average is 5 patients a day would
mm,
be like pretty average across all our services in Australia.
mhm.
Some people see more because they just want to see more clients per day. But I'd say 5, max 6. So is 7 to 8 pretty standard in Switzerland?
No.
Okay.
I um well, I'd say we're on the higher range of how many people we should see. I mean, in total, you just have to kind of be able to have 7 hours of therapy
Yeah.
each day. And, sometimes you kind of overbook, because sometimes people, cancel or they're sick, and then you kind of lose those hours. And then yeah, it's like in the system where I work, it's kind of like built up like that it always
Mm.
should be 7 hours. I mean, nothing happens if it's less, but they would prefer you to have 7 hours a day, which means that sometimes you kind of overbook yourself. And that's the thing that I also still have to learn, is limit myself, to be
Mm.
available, because I think that's a bit of a disease of every psychologist to be available all the time, like a firefighter and running around. But it's like 5 to 6 patients. I would say
Okay.
very similar to Australia.
Okay, sure. So I wanted to shift to, I guess, starting to deliver therapy. Sometimes it can be really overwhelming when you're first
Mm.
learning to deliver therapy and you're getting in the room with like 6, 7 clients a day. What was
Mhm.
that experience like for you in the beginning?
I always had a visual in my head, like a picture of how I felt. It's kind of like you're drowning and swimming at the same time. Yeah. I don't want to like make people scared or anything, but it is overwhelming. And I personally think it really helped to have my own personal therapy, my supervisors next to me, kind of to help me out to get through this phase. But also at the same time, it made me really resilient towards seeing a lot of people and being able to know that I will find the way that fits me, but also fits the people that come to me and trust me. And yeah, so in the beginning, it was a bit a back and forth of emotions, and and also maybe a bit of self-doubting sometimes, like, is this really what I want to do, or is like will it ever change, or will it just stay that way, to just feel that way, drowning and swimming at the same time. But yeah, I'm happy to say that that has definitely changed, and to the good, and you learn to swim, I'd say.
What do you think made it better so that you were drowning less? Like, what helped?
I often kind of felt pressure to like do it right. And then especially if you're in group therapy, like your personal group therapies, and then you just hear other people talk about how they are doing it, and then you kind of compare, and then you're just like, shit, like I'm not doing it like that. Well, then something is wrong with me, or like I'm not doing it right. So yeah, so that was definitely at the beginning, but over time I learned how to deal with that, and to not like have the perfect techniques, that it's more about like being there for the person, and listening, and feeling them. And like interventions, they're great, and they can help definitely, but in the end, it all comes down to relationship, and how we are in this in between together in this room. And that kind of made it easier for me to kind of lift this pressure off, and also allowing to do mistakes.
Mm. You said that in a really beautiful way. I really love how you expressed that.
Good,
Yeah,
thank
like
you.
that idea of it's like we put so much pressure on ourselves to have these perfect techniques, but in the end, we realize like, hey, we're building a relationship here. And that is,
Exactly.
yeah, that's like the techniques are good, like you said, but it's like the relationship is ultimately what's important, and we know how to do that.
Exactly.
Yeah.
And that's just, it's such a great feeling if you get to that point of just feeling not to do it right all the time, and just being this flow, and just trying things out as well. Like be open to just try, and don't work uh with a rule or like a plan. Just kind of be be with the people. Just yeah.
Mm.
It's usually the most important thing in the end. To just
Yeah,
be there.
absolutely. Yeah, and it's like I really like getting personal therapy as well because it's like if I asked you what do you remember from your personal therapy, you probably wouldn't say to me like, "Oh, I remember when she did this great technique and it was the technique that I remember most of all." It's like most of
No.
us aren't going to say that. We're going to say, "Oh, she was listening and she was attuned to me and she understood me right."
Exactly. And for
Yeah.
me, it was also about like, oh, I got a yummy coffee to
Yeah.
drink during. It are just like those simple, simple relationship things, like this intimacy, kind of like just through being, and
Yeah.
just being human, and not being the one who's like a teacher in front of them. So yeah, definitely.
Yeah. And so something else I think that can come up during, I guess, early career is a risk of overworking and crossing your
Mm.
own boundaries. You spoke before about how sometimes we can do that, but I just wanted to hear a little bit more about what overworking might look like and any patterns you've noticed in yourself.
Mm-hmm. Mm-hmm. Yeah, often in the beginnings, I've noticed, also looking back now, like kind of taking on too many clients, which honestly hasn't really changed. But so that's definitely something I'm still kind of figuring out. Because sometimes it, like nowadays, I kind of know how I have to deal with it, which wasn't the case in the beginning. There, I was just like, oh God, overwhelmed. Um, and next to that, I also kind of sometimes skipped breaks, or I once read something about like you're like in this high stress level of life when you kind of have crumbs all over your PC and computer tabs and
Mm.
stuff. And there was actually a moment where I just saw that, and I was like, "Oh God, like
This is
you
me.
should yeah, you should take breaks." And also like it can be so emotionally heavy some cases, and it's just so important to just recognize your own limits, to really feel into yourself, tap in, and just feel and see, like, is this something I can actually do, or is it just something I do because you kind of just have to, or someone tells you have to, or should see the people that
Yeah.
have been kind of given to you. So, yeah, that was definitely something in the beginning where I was just like, my God, like, how do you cope with everything? So, yeah, nowadays I'm really aware and protective of my time and energy, and just making sure, like, those are like fixed things to really look out for. For example, like in my personal therapy, my therapist told me about, like, psychology can be really tough, and therapy can be really draining at some point, and it's so important to make sure that you at least have those 1 or 2 days in a week where it's just for you. It's about self-care and listening to yourself, and just do what kind of gives you energy again. And then the rest of the days you just plan as you kind of do, or meet friends and stuff, but really just have those blocked days to just kind of get normal again, and stay grounded, kind of. And that actually really helped. So I really focus on that most of the time, to just
Mm.
have those wind down hours and days.
And do you find that helps?
Oh, 100%. Like, what I could really recommend is find something where you can just also let out the emotions, because I think we are holding so many emotions at once, and sometimes I feel like it's not, sometimes it's not, you're not capable of kind of letting them out a certain way, and then they kind of get stuck in you.
Mm.
And so I really recommend to find something that where you can just let it out, and just oh, be there, but don't think about work, but still, like, process the emotions. And yeah, for me that's definitely playing football.
Oh,
So
great.
yeah, and I could really recommend it. I know it's not for everyone, but there are like women's teams. So yay.
That's so cool. Yeah, and I can just like, because I was thinking as you were speaking, I was like, I really enjoy dancing. And so I take like a
Nice.
dance class every week, and it's such like a
Cool.
great way to like get it out there. And I'm imagining
Yeah.
like you kicking like it'd be soccer in Australia. I think your football is.
Oh, soccer.
Um,
Yeah, yeah.
yeah, yeah. But it's like kicking the ball and like having teammates and having fun.
Mhm.
That's a perfect way to translate emotions and get it out there.
Exactly, exactly. And wow, dancing, yes, 100%. It's
Mm.
such a nice way of just feeling your body as well, and just
Yeah.
mm,
Yeah,
super
totally.
nice.
And I've found that, yeah, having those hours for yourself is really important. I found that really effective for me as well. So
Hmm.
like because I do research and clinical work, and
Nice.
on non-clinical days, I do not check the email of the clinical inbox. So it does not come in. Um, and I've found that that's very effective, because otherwise I will look and then I'll see something and I'll be like, oh, and then I get the emotions of
Yeah.
that. So I'm just like, no,
Yeah.
it doesn't exist to me.
Yeah, and that's such an important point, right? Because it all comes down to have limits, have boundaries, stop yourself of overdoing the things, or wanting to be everywhere but kind of nowhere at the same
Mm,
time. So
yeah.
yeah.
Mm. I wanted to ask you about inner critic as well. So this can be a big thing when we're starting out. We often judge ourselves, and like you were saying before, like, oh, am I doing it right? Maybe I'm not cut out for this.
Hmm.
I just wondered if that's changed for you over time.
Hmm. Yes, yes, I'm way more easier with myself, and my, like, this critical voice in me kind of just got to the point where I'm just like, well, that wasn't nice, or like, Tiff, that could have been better, but hey, I've learned something. Well, let's not do it again. So kind of more like taking it from a humor side, I'd say that really has changed. And I'm happy about that because I can really see it in like early career psychologists that's something they are sometimes struggling with, and it's like very normal, and I think everyone went through that, and some might still go through that, but I think with humor you can also laugh it off sometimes and make it
Mm,
a bit more easier on you. It's not that you just push it away, but it's just seeing it as, hey, I'm human. It's normal.
mm.
I'm not perfect, and that's perfectly fine.
That's a really nice way of putting it. Um, so one thing we talk about on the podcast pretty
Hmm.
regularly is this idea of niching. So it's like that you might see one particular presentation, like you only see adults with depression or something, and that can help reduce, I guess, mental load and focus your trainings and stuff. Is there like an area or presentation of interest to you, or do you see everybody?
Well, my main focus is on depression and anxiety disorders,
Okay.
but they usually come with everything else as well.
Yeah.
Those usually you just don't have just one, but you
Yeah.
usually have a pack. I
Yeah.
always I always view it as like having a bouquet of flowers.
Yeah.
And it's
That's so
just
funny.
like all the different flowers in one, which makes it so interesting, I think, our work. But usually my main focus is on those two things that I just mentioned.
Yeah.
And yeah, but what I really find very interesting, I don't know how it's in Australia, because usually we're like two years behind you guys, but
Oh, okay.
we're yeah, with movies and stuff, but
Okay.
um now, like, at the moment we have like this trend where a lot of psychologists are like ADHD, like
Yes, we have
diagnosing
that.
ADHD and
Yep.
ASS, like autism spectrum disorders, and then you're just like, well, literally everyone has that. And I don't know how it's in Australia, but I think I I'm I'm actually not so, I don't know what I should think about that trend, because it has become a trend, especially with things going viral and also with trauma. A lot of people are using the word trauma, which is in psychology, like I personally think it's like this, it's too easy used in
Yes.
just, and I think it's way deeper, because in
Yep.
the end, yes, everyone could have a trauma, but I think the wording is a bit, mm, yeah. I'm not so
Yeah.
satisfied about that.
Yeah. I mean, yeah, lots of interesting things in there. So I think with the trauma, it was really interesting. I went to a lecture maybe 2 months ago now, and it was
Mhm.
about this idea the researcher called concept creep. And the idea is that like the word trauma might have started out meaning something. And like when trauma first came in, it was in the DSM-3, and trauma was
Mhm.
like what war veterans experienced. And then the
Exactly.
concept creep is that it's gone out from what war veterans experienced to everything else. And
Hmm.
it's really good because then we can pick up like, emotional neglect and physical
Yeah.
violence as trauma. But then it's
Yes.
spread out even further. And then it's like, I didn't get the sandwich I wanted at lunch. That was traumatic. So,
Exactly.
yeah,
Yeah.
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 So it's like, yeah, so that's something that I think like people are writing and researching here in Australia. And then with the ADHD, I definitely know because I started like in 2017. So that's when I
Hmm.
started as a psychologist. And I definitely noticed an increase. I think the first time I noticed that I was like, a lot of people are coming for ADHD was about in 2020. And maybe that coincided with the pandemic. I don't know. But here in Australia, we're pretty much thinking like people have missed out on diagnoses. So we're just picking up more
Hmm.
people who should have been diagnosed. But like,
Yeah.
I think it's taken a few years to kind of get to that point.
Hmm.
Yeah.
Yeah. Yeah. And it's also like with the diagnosis, I because people are able to come via their GP, and it's paid by the insurance, the health insurance, and yeah, it's like this system where you kind of have to give a diagnosis.
Yes.
And I honestly sometimes have a hard time. But
Yeah.
I don't know if that's just me or if it's with others as well, but I think it's really hard.
It's pretty hard here as well. So we have something called Medicare. And with Medicare, we have to give a diagnosis for them to access the government
Mm,
payments for the session. And so it's pretty difficult because sometimes GPs will refer for depression, anxiety, but somebody
mm,
doesn't actually meet the criteria for those conditions. So like
mm,
it puts a bit of pressure on the therapist to be like, well, if they
mm.
don't diagnose them with depression, anxiety, they won't get the
Yeah.
money. Yeah. Is that similar to you?
Yeah, yeah, yeah. We like so how it works with us, it's like you can come 30 times to therapy.
Wow, that's really good. We only get 10.
It's a lot. It's like this nurse system where you can come for 30 sessions in total, and
Yeah.
then on at the 30th session, we usually have to write a report for your
Yeah.
health insurance, and there we have to include a diagnosis.
I see.
And then the insurance decides how many times after the 30 sessions you can come again. And
Oh, wow.
usually it's like up to 1 or 2 years again of just regularly each week you can have therapy. So
Wow.
it's a lot of therapy you can actually get. But yeah, after 30, there you definitely have to have a diagnosis kind of.
Yeah. So do you
Yeah.
find that you see clients for like many years, or do you find that people go away and come back, or?
hmm I'd say it's pretty mixed. I do have a lot of patients that I kind of walk the journey since I think it's around 2 years now, and it's such a nice. I really like them, and it's like nice having them around and also trusting me kind of
Hmm.
in what we do. And but I also have people that are very like they got very good again, and they feel healthy enough to just walk their journey by themselves, and we usually just have like check-ins like every 3 or 6 months to just see how is it going, and just
Yeah.
very easy paced.
I wish we had that. It's literally like a huge political issue here with like, we only get 10 sessions of government
Wow.
funded therapy. And like for years, our professional associations have been lobbying the government to increase that
Mm-hmm.
because we're like, we can't even deliver like, standard cognitive behavioral therapy for like trauma or something with only 10 sessions.
Wow.
Yeah.
Wow,
So
that's
it's,
that wow, that's a lot of pressure, I
yeah,
I
it is.
assume.
Yeah.
Wow.
Yeah.
Oh,
It's like I think it's one of the worst things about doing therapy here in Australia because at the outset of session 1 you have to be like, okay, we've got 10 sessions or like you'll need
it's
to pay
like
out of pocket. Yeah.
it's like a factory kind of.
Yeah.
It's like
Yeah, it
baking,
does.
and then you're like kind of throw them
And you're
out.
out. Yeah.
Oh God. Okay. Wow. No, God. I mean, it takes me like 10 sessions almost to kind of build a relationship.
Yeah. Oh my gosh, totally.
Oh gosh.
Absolutely.
Okay.
Yeah.
Wow. Oh,
Tiff, I wanted to ask you if you
sure.
had any other thoughts or advice for early career clinicians that you just want to get off your chest and let them know.
Yeah, definitely. Oh, first of all, just breathe. You're
Mm.
okay. Everything is normal you're going through. And really just set clear boundaries. And I guess that's a thing that can take years, speaking of myself. And really find a good supervisor who kind of supports your clinical growth, but also like emotional regulation, and just is there for you if shit hits the fan, kind of.
Yeah.
And just take breaks seriously. Listen to your body. Actually, just just listen to whatever you also teach your patients, because it applies to us as well, and we kind of tend to forget. And yeah, just be curious, learn as much as you can, and want to learn, and just practice self-compassion throughout your whole journey, and just, yeah, have fun.
What would you say the most rewarding aspect of your work is?
Oh, there's so many things. I think I'm like the psychologist who really think it's really nice if we get to this point where we activate emotions. And I think that's such a beautiful, beautiful setting where you kind of hold and feel and experience emotions together. That's such a reward for my therapy as well. But also seeing that people get better and it helps if you're also willing on kind of doing a bit of work, because it's not just the knowledge, it's also the change that has to be applied at some points. And I think if you see that happening, it's such a nice, I don't know, also the vibe in the therapy, it just changes, and it's such a nice feeling to see. And yeah, to see people become better and healthier and more aware. It's really
Mm,
nice.
wonderful. Tiff, I think we're coming to the end of our conversation. What do you
Yeah.
hope that listeners would take away from it most of all?
Yeah. I think to not have all the answers, to
Mm,
to just ride on this wave of uncertainty, and also just having your support system and looking out for yourself. I think that would be the most important thing, to really get back to yourself, breathe. And yeah, most of all, I really want early career psychologists to to have fun as well, you know, to not see it as a burden. Uh yeah. Oh, it's
yeah, me
such a big
too.
topic. Yeah.
It is a huge topic, but it really speaks to me as well. You know, something I'm actually working on right now is even after years, it's still like I'm trying to let go of needing to know the answer and instead
Mm.
being curious together about what
Yeah.
solutions and options could be and just being
Yeah.
comfortable with being curious together. But
Yeah.
yeah, it's a great bit of advice and it's yeah, I think something worth working on.
Definitely. And just be a team.
Yeah.
Yeah.
Well, thank you so much, Tiff. It has been so lovely speaking with you. It's so great to connect across the hemispheres, and we got
Yes.
our time zone correct. Both of us were like, "What time zone are we? Where do we meet? What time is it?" And we actually, you know, I tried ChatGPT as well to help me work out the time zone, and I still didn't really understand. And we're both just like, "Oh my god." So yeah,
Yeah.
it's so good that we could work out the hour, and I'm so glad that you could come on. Thank you very much.
Well, thank you so much on having me, and yeah, just feel free to reach out or anything, and I'm happy to help if anyone from Australia ever wants to come to Switzerland to work here. And to not just visit the Alps and the snow and the chocolate. So yeah, it was a pleasure. Thank you.
Yeah, no worries. My pleasure. If people want to learn more about you or get in touch with you, where could they find you?
You can find me on LinkedIn. It's Tiffany, oh, Limacher, as we call it here, like Limacher. It's Limacher,
Yep.
or even like via email. Like it's T and then my name, Limacher, the one that I just
Yep.
kind of told you, at gmx.ch. And yeah, I'm always open and enjoy connecting with other clinicians, or just people having questions, or
Yep.
wanting to discuss something that I said. So just
I
go for it. I'm open.
I bet you will get somebody contacting you because there are a lot of psychologists here who love traveling internationally, who like have dreams of being nomads and then they can go do therapy elsewhere. So I reckon you
Nice.
will get at least one or two people reaching out being like, yes, Switzerland's for me. I want the chocolate. I want the therapy.
Yes.
Yeah.
Then I'm your girl.
Yeah. Well, thanks so much again, Tiff. It was lovely speaking with you.
Thank you. Thank you so much.
Listeners, if you enjoyed this episode, please follow Mental Work and make sure you share the episode with somebody else. I'm Bronwyn Milkins. Have a good one and catch you next time. Bye.